I'm Dr. Carrie Pagliano, a pelvic floor physical therapist and perimenopause and menopause expert, also going through perimenopause myself. All right, one of the things I want to talk about is a new onset of urine leakage when you're entering those perimenopausal years. So what am I talking about? So early perimenopause is between ages 40 and 44. Regular perimenopause would be 45 to 50. And typically the average American is going to hit menopause at around age 51, and menopause being complete stoppage of your period for at least 1 year. Now, around those perimenopausal years, what can happen sometimes is women who previously did not have any issues with urinary incontinence might notice leakage. It might be with activity, it might be with running, it might be with workouts, things like that, something that they'd never experienced before. Maybe they had it in postpartum, it got better, and now all of a sudden it's back, or they've had it for the first time. And it gets really confusing. People think, oh, this is just old age, this is what happens. No. Genitourinary Syndrome of Menopause is the name. And what this basically means is these symptoms, you can have vaginal dryness, urine leakage, increased frequency and urgency, even UTI frequency can occur as well. These symptoms can occur related to reduced local estrogen in those tissues. And what happens is we have estrogen receptors in a lot of those tissues down there. They're in the blood vessels, in the urethra, they're in their bladder, reproductive organs, all of that. And so you can end up with leakage related to a decrease in local estrogen. So the solution is, one of the solutions, one, talk to a pelvic floor physical therapist. We can be incredibly helpful. But one of the things that I always want to check that box is addressing local estrogen and talking to your gynecologist about a prescription for local topical estrogen. And what that means is you're replenishing, and it's not systemic, it's local. You're replenishing the local supply of estrogen in that area so we can plump up some of those tissues again that provide integrity and support and decrease. That's one of the mechanisms for continence, but it increases the integrity of those tissues, and it's going to decrease those leakage symptoms. So if you're in an age range where you might be perimenopausal, you're potentially, noticing other perimenopause symptoms, you're having leakage seemingly out of nowhere, we want to check that box. So talk to your local pelvic floor physical therapist, and also talk to your local gynecologist about potentially if a prescription of local topical estrogen might be right for you. If you have any questions, I'm Dr. Carrie Pagliano.